Now to COVID-19 and new efforts to try to clear the backlog of tests and reduce the lineups. The federal government says it has struck a deal to buy nearly 8 million rapid tests for use in Canada. The test is called ID Now. It's made by Abbott Industries in the United States. It claims to process results on the spot in less than 15 minutes. Right now, many Canadians have to wait days for COVID-19 test results. There's a problem, though. This new rapid test has not been approved by Health Canada. And as Mike Le Couteur explains, it's unclear when it will be.
The federal government wants to be able to test up to 200,000 Canadians per day for COVID-19. Backlogs across the country mean on average, we've only been able to test 71,000 people daily over the last week. So you're waiting hours to get tested and waiting up to 7 days for results.
The powerful point-of-care molecular instrument that is ideally suited for use on the front lines.
Enter the Abbott ID Now. The American-made test can turn around a result in 15 minutes and is being widely used throughout the United States. Our government announced it has secured up to 7.9 million tests.
We have pursued an advanced purchase agreement to secure Canada's access to these tests, conditional on Health Canada regulatory approval.
That lack of approval means they won't help ease the long lines across the country just yet. And Canada's top doctor says the tests may be most effective in remote areas.
To areas where you can't sort of send your samples without a really long turnaround time and you have to fly your samples, for example.
Dr. Teresa Tam did add those tests could help in high exposure areas where you need a quick turnaround on results. But there have also been issues with the ID Now test. The U.S. Food and Drug Administration has received dozens of reports of false negatives. The high-risk B cube has been approved by our health agency, but there is no purchase agreement. It's why the Conservatives say the Liberals have dropped the ball.
We're in a race to get these technologies. There are many other countries around the world that are trying to procure them, that are trying to manufacture them, that are trying to develop them.
The health minister contends the government is working flat out on this file.
We have also accelerated our processes at Health Canada to make sure that as new technology arrives, we are well placed to approve it. We have doubled our regulatory capacity.
Despite that, since March, Health Canada has only approved 3 point-of-care testing devices, one of which is for research purposes only. Donna?
Okay, Mike Le Couteur in Ottawa, thank you.